I'm Dr. Sreenivasa Murthy TM. So, what is earwax? Medically, we call it as cerumen. Now, cerumen is actually a secretion from specialized glands called ceruminous glands, which are found in the skin of the outer ear. Our ear has three parts: outer ear, middle ear, and inner ear. The outer ear is a canal which is lined by skin, and at the end of the canal, we have the eardrum. Now, all along this skin, you have these glands called ceruminous glands. Now, they secrete wax. Now, this wax is typically an amber colored, honey colored secretion, which it is basically secreted by the body, small protective layer over the skin to prevent some infections or breach happening in the skin. It is very similar to glands which secrete sweat, the sebum that we have, that oily material on the skin. One of those glands, similar gland is a ceruminous gland, but it is found only in the skin of the external ear. 95% of the human beings don't require ear cleaning because they have a natural self-cleansing mechanism. Only 5% of human beings don't have the natural self-cleansing mechanism, in whom the wax tends to accumulate, and when it accumulates, it will cause blockage. How do we treat it naturally? Can we prevent wax accumulation? No, we cannot, because it's a natural secretion from the body. Most children in the first 6 years of life will need at least one cleaning of the ear, because by the time they are 6 years of age, the canal becomes the size of an adult, and over those few early years, lot of material can get accumulated in the ear because of the narrowness, and then they may not have the capability to push all of them out. So they will require at least one cleaning in the first 6 years of. There have been many people lived their lives without getting the ears cleaned even once. But after the first cleaning, which happens in the first 6 years of life, majority of the human beings don't require ear cleaning. Only 5% will require. Now, even amongst them, there are people who have it only on one side. They'll have accumulation only on one side but not on the other side. Why does it happen? We don't have a very clear-cut answer for that. What happens when wax gets accumulated? It can cause some amount of itching. Patient will feel like digging into the ear, trying to remove it because it causes irritation. If the amount becomes voluminous enough to cause complete blockage of the ear, then they will have a sudden blockage of the ear, especially following a head bath or swim. When water enters into the ear, the wax can swell up, and once that swelling happens, you can have an absolute blockage. Now, once the absolute block happens, a person can even experience some ringing noise. Sometimes this absolute blockage can erode into the skin, causing secondary skin infection, and then you can have pain. It can touch upon the eardrum and then cause pain. So usually these are the symptoms with which the person would meet the doctor if they have accumulation of wax. These people who tend to accumulate wax need to get ears cleaned ideally once every 6 months.